Back to one of our top stories now. Deputy Health Minister Dr. Phaahla has assured the public that the latest fire at Tembisa Hospital has not disrupted services. The hospital suffered a second blaze this morning, this time in the filing room. Phaahla says the emergency services remain suspended since the first fire over the weekend. The cause of the blaze is under investigation. Phaahla joins me now. A very good evening to you, Deputy Minister. Thanks very much for your time. I mean, another fire in as many days that is bound to raise suspicions.
Well, evening, Vuyo and your viewers. Well, indeed, this raises suspicions. While we're all still dealing with the first fire on the Saturday evening, then this morning we woke up to the news that another fire had started within the same kind of complex in a way, because the first one was what you call accidents and emergency unit, and then this one, it's just across in the outpatients department, in a room which was used for filing patients' records. So you're talking of maybe about just in terms of distance, something like just over maybe 70 meters, 80 meters distance from the previous one, but from the naked eye looks not directly connected because the other one had been extinguished. So it's especially this one, well, including the fact that we still don't know what started the first one. They're all looking very suspicious.
It looks like, or it doesn't look like, in fact, this was confirmed, I think, by the hospital management, excuse me, that there was no CCTV coverage where these files were.
Well, generally, I mean, the first one, the Saturday one, because it actually, started inside the emergency services area. I mean, even if for various security reasons, if they would have had cameras inside, maybe they could shed some light, but because of the fact that, I mean, well, the systems would differ whether they would have recorded something, because that area is completely gutted. Any equipment which would have been inside the accident and emergency unit would have been totally destroyed. Everything inside there is totally destroyed. The second one of this morning, what the CEO said to us was that they will find some image. There's a camera which does focus on that area, well, because that area is not totally damaged. And if the camera also is externally, it might have been able to pick up something, but she was not very optimistic that it will shed sufficient information. They don't have one which is directly focused in the records room itself.
I got a bit of of your question and answer session with journalists earlier, where you said you were having difficulties finding out what had actually happened in previous instances, not only in this hospital and elsewhere. What seems to be the problem with hospital systems, that it becomes difficult in situations like these to find out what actually happened?
Well, part of the problem, Vuyo, is that, as you would know, I mean, the hospitals are a hive of activity. I mean, one of the things which, I said, okay, let's leave it to the experts. Maybe they may be able to, as they question more people, because one of the things which I asked was the accident and emergency room. I mean, it's a 24-hour around the clock busy area. In the area like Tembisa, I mean, I asked plus minus how many people were in the accident and emergency, and they said just over 80 patients and just over 20 staff members. So all in all, when the fire broke out in the accident and emergency, there were just over 100 people. But in terms of even over and above technology, just in terms of zeroing down to say, what did anybody say, this is what I saw where the spark started? And they were saying they couldn't just pin down anybody who could say, this is where I saw a spark. Instead, other people said they felt smoke, the kind of smell of a fire, kind of smoke, but in terms of where it was coming. And then soon after that, there were flames, and they had to immediately get everybody out. But I mean, there you can see it was fierce because even, apparatus, emergency, apparatus which are there, which are used by emergency services, nothing has been salvaged. Even those which are made of steel frames, including, I saw even some few wheelchairs which could still move, but most of the equipment is totally destroyed. So which meant very intense heat. But what puzzled me was in an area where there were more than 100 people. I mean, even at least even if you just talk of staff of over 20, and nobody being able to say that's what I identified as where it started. But I said, well, we'll have to maybe as the law enforcement interrogates more and more, we may find something. But in the area of the records as well, I mean, it's an area where people go in and out to retrieve records. So I think part of what makes it difficult compared to other industrial areas where they may also be maybe very strict in terms of access in a hospital and health service institution. There's a whole lot of you have certain guidelines and rules, but at the same time there have to be a number of people who have access to various parts, and I think that also complicates things.
Which then, I mean, decreases the likelihood of you finding answers this time around as well. I mean, if the situation has been going on for far too long. But why are many health facilities across the country not occupational health and safety compliant? Something you admitted to earlier.
Yes, I did comment on that to say yes, indeed, we acknowledge that many of our facilities are not health safety compliant. There has been a lot of movement towards that, especially during the COVID period. We did push for more and more health and safety compliance, but especially when it comes to fire safety, there's a lot which still needs to be done. Many of our buildings, I mean, including Tembisa Hospital, I think it's somewhere around 45 upwards of 50 years of age. And you would find that in the earlier periods, the building standards did not really, enforce a lot of occupational health safety, including, fire safety, in terms of fire detectors, in terms of, even things like sprinklers. There's some attempt to meet some, some requirement, but it still falls far short. There has been an assessment just in terms of, for example, in the Gauteng province, where they've actually costed in all the facilities and arrived at a figure of around figure of just over 4 billion rand, which is required because, I mean, having been quite involved previously with addressing the issues at Charlotte with some of the specialists, I'm quite aware of some of the things which, for instance, increasingly at Charlotte Maclake have had to be done because the Johannesburg Metro made it quite stringent that for them to issue a certificate of use, certain requirements needs to be. But even there, it's not yet been 100%. So in many of the facilities, it's been assessed. We just need to make sure that in our push to improve the infrastructure, the issues of occupational health, including especially fire safety, is also part of those efforts to improve the quality of our infrastructure.
I mean, speaking of Charlotte Maxeke, there are still no consequences even there for the culprits who are responsible for the misdemeanors we saw there.
Well, I mean, I'm subject to some detail, but if I recollect what the reports which we got after some intensive work by law enforcement was not absolute, kind of certainty in terms of what would have started the fire. It was finally said that all kind of, evidence suggests a human factor in a way that it was not an electrical fault or something like that. But in terms of that human factor, exactly pinning it down, you are correct. There has not been any specific somebody who has been held accountable for that.
Deputy Minister, thank you for your time. That's where we're going to leave it for tonight. The Deputy Minister of Health, following, of course, that second fire in as many days taking place there. But, of course, we shall see what the investigations manage to unveil.